learn about the patient counseling. What is patient counseling? Patient counseling is counseling the patients about their diseases and the medicines which they are using, and what are the life change modifications they want to do in their daily routine of life. And for that, first we want to have the communication skill, and for that, for an effective communication, what are the points needed? Language, tone, volume, speed, proximity, eye contact, and facial expression. What do you mean by what will be the meaning of language? Language should be which means the way you are speaking should be understandable to the patient. So mostly we will prefer the language of the patient, their mother tongue. Do not use the medication abbreviations or medical related terms that will be not easy to understand the patients. And the tone should be not in a high pitch and not will be in a low pitch, should be in a normal way and should be easily hearable to the patient. And also the volume is also where we are speaking and to whom we are speaking will be the volume will be depend on that. If we are speaking on a public, the volume should be raised. If we are speaking in a room with one patient, and our volume should be low and should be audible to the patient. And if the patient is having a hearing problem, then our volume should be louder. And speed, which means if we are going in a rush way, the patient will think we are in a hurry and we are not interested to counsel the patient in a proper way. And proximity, what are the distance, what will be the distance we want to keep between patient, counselor and the patient. That is explained in the proximity. And eye contact and facial expression. When we are talking to one person, eye contact and facial expression is very important. If we are speaking in eye to eye contact and with nice facial expressions, that will be easily understandable, and the opposite person who is hearing us will be very easy to hear that. They will get some interest to hear what we are saying. And the steps we needed is preparing for the session, counseling content, closing the session, getting started. And that is what all are the, and in that all these are the contents which will be included in the counseling. Then counseling aids. Counseling aids is the materials which helping us to counsel and them to understand very easily. What all are that? Newsletters, bullets, and which will be available about, which is telling about their disease and about the medicines and the lifestyle modifications, all those things. Then counseling aid. What all are the counseling aids? Newsletters, bullets, all those things. And what will be there inside that? About their disease, about not only about their disease, about the disease, and what all are the lifestyle modifications they want to do. All those things will be there. And third one is closing the session. How we will close the session? We want two things we want to make sure from them. What all are the things we said to them is understandable to them, and if they have any queries about their disease or anything related to the medicine, if they have, we will give space to them to ask their questions. So we will close the session by taking questions from there, and we will repeat the things which we had said from first onwards, and we will ask if any queries are there about, and if they have any doubts regarding the session we had done. All those things will be taken from them, and we will end up our patient counseling. Thank you.